Imagine this. A patient finally discharged after a hospital stay steps back into their home, a mix of relief and uncertainty washing over them. The sterile efficiency of the hospital fades, replaced by the familiar but daunting reality of managing their own recovery. This transition can be overwhelming. It's no wonder that hospital readmissions are a persistent problem in healthcare. The statistics are stark. A significant percentage of patients, particularly those with chronic conditions, find themselves back in the hospital within weeks, sometimes days of discharge. This revolving door phenomenon is not only detrimental to a patient's well-being, but also places a huge strain on our healthcare system. These readmissions are often preventable, stemming from issues such as medication errors, difficulty understanding discharge instructions, and lack of timely follow-up care. The journey from hospital to home should be a smooth continuum of care, not a jarring leap into uncertainty. The challenges patients face after leaving the hospital are multifaceted. Imagine being handed a stack of papers filled with medical jargon, complex medication schedules, and vague instructions about when to seek help. This information overload can be overwhelming for even the most astute patient, let alone someone recovering from an illness or surgery. Adding to the complexity is the lack of consistent follow-up. Patients often leave the hospital with scheduled appointments weeks away, leaving a critical gap in care. During this vulnerable period, questions arise, symptoms may worsen, and without immediate access to guidance, even minor issues can escalate, leading to readmission. The impact of hospital readmissions extends far beyond individual patients. The strain on our healthcare system is immense. Hospitals operate with finite resources, and the financial burden of readmissions is substantial. Each readmission represents not just a financial cost, but also a missed opportunity to provide care for another patient in need. Furthermore, the pressure on healthcare professionals is relentless. Doctors and nurses, already stretched thin, are burdened with the added responsibility of caring for patients who might have avoided readmission with better post-discharge support. This cycle of readmission perpetuates a system grappling to keep up, ultimately compromising the quality of care for everyone. Introducing MyJEEVA, your personal recovery companion. In a world increasingly reliant on technology, it's time we harnessed its power to address the critical need for better post-discharge care. This is where MyJEEVA steps in, a revolutionary AI-powered platform designed to be a patient's personal recovery companion. Imagine a world where patients leave the hospital not with a sense of trepidation, but with confidence, knowing they have a dedicated ally guiding them every step of the way. MyJEEVA makes this a reality. MyJEEVA acts as a virtual bridge between hospital and home, providing patients with personalized support, medication reminders, symptom tracking, and direct communication with their care team. No more deciphering complex instructions or waiting anxiously for appointments. MyJEEVA empowers patients to take control of their recovery. Revolutionizing recovery, the power of continuous care. MyJEEVA's impact, however, extends beyond individual patients. By ensuring smoother transitions and reducing preventable readmissions, MyJEEVA helps alleviate the strain on our healthcare system as a whole. Hospitals can utilize resources more effectively, and healthcare professionals can focus on providing high-quality care without being overburdened by preventable readmissions. The potential for MyJEEVA to revolutionize post-discharge care is immense. As we look towards the future of healthcare, embracing innovative solutions like MyJEEVA is not just an option, it's a necessity. By investing in MyJEEVA, we're investing in a future where healthcare is more personalized, proactive, and effective. Let's work together to reshape the landscape of post-discharge care and empower patients to thrive beyond the hospital walls.